Hi. So today's video is all about appointments. So if you are someone who schedules appointments, then this video should be helpful for you. Okay. So the first thing you need is access to the appointments button or icon in Profiler. And what you can do is you see I have appointments as a shortcut, this right here at the very top left of my profiler. Now, if you don't have that, you can click this little down arrow. And if you don't have anything up there, like appointments and my appointments, those shortcuts take up space, right? So if you don't have anything here, it's blank here, then this little down arrow would be very close right next to this little search icon here. So I'm going to click on the down arrow, select more commands, and I'm going to click on that drop down and select form to open, and then you'll see appointments here. So I could click on appointments and then this add button would be available to push it kind of over to the right. And the list on the right is the shortcuts that you have. Okay, so then I could also do one called My Appointments, and they're in alphabetical order, so you just scroll down to the M's. That one is useful if you're someone who has appointments. So if you're a scheduler who's scheduling someone else, you would need appointments, but not My Appointments. If you are someone who has appointments in Profiler, like a therapist or a doctor, then My Appointments would also be useful for you. Okay, so it really just depends on what your job responsibilities are. Okay, so then I'm going to select close as soon as the items that I want are in the list to the right. And then those are the items that will appear up here in the upper left. Okay, so either way is fine. I'm going to click appointments from the icon just because it's big and cute. Okay, and so when you click appointments, this screen will open. One thing to keep in mind about the appointment screen is that it doesn't give you any information until you ask for the information. And the way you do that is to tell the screen what you want to see. Okay, so if I just click load, I get this selection. You must select a location and provider. So see how I haven't provided any information over here to the right? The scheduler doesn't know what I want to see because I haven't given it that information. Another thing to keep in mind is the date boxes on the left. See how it defaults to just one day? Okay, so see that's where this little, either the date range and its calendar, okay, or the buttons here where it says, see where it says month, I could look out a month, I could look out a week. It really just depends on what type of date range I want to see. So just to get us started, I'm going to leave it at one day just so we can look at what today looks like in the calendar. So over to the right, just like it's prompted me already, I need to select a location. Now please keep in mind that as this video is coming out, we are in transition of moving and some of these location names are subject to change. So the thing to keep in mind is wherever your location is named that contains your program, that's the location that you want to select. So right now, August 13th of 2020, okay, iCare is still marked under the location Virginia Beach Boulevard, but just keep in mind that that's subject to change, okay. Now, after I select a location, I should see a list of providers who provide services at that location using the profiler schedule, okay? So these are all doctors and nurses in this list. Now, if I was to choose a different location, So I'll switch to ITCN, that's our infant and toddler connection, and I click this provider drop down. I get all the infant program providers that I have access to. Okay, so the list of providers depends on the location that you've selected above. So if you don't see providers you're familiar with, maybe, or it says no selection, it might just be that you don't have the right location selected. So just kind of keep that in mind. So for this example, I'm going to use our medical director, who is Dr. Forte. I'm going to use his schedule, but please know that all the scheduling works kind of in the same exact way, no matter what location or what provider you choose, the process is going to be the same. Okay. So now that I have Dr. Forte selected, I have my location, I want to see his schedule for today's date, I've got all those things figured out. Then I'm going to click on this icon here. And if you put your arrow over it, it does say load dates and context selected, which the text makes sense, but the picture is silly. Looks like a coins with a exclamation mark, and I don't really know how that picture goes along with the text, but that's what the icon looks like. So I'm going to click on that. And then I'm going to raise my window up just a little bit. Okay, so I can see that Dr. Forte's day becomes available at 7:30 in the morning, but I can see on this particular day, see all this kind of purplish gray? That means unavailable. Most of our providers' schedules will also look like this on the weekends and at night. It means they're not available during those hours. So I can quickly see that I should not schedule Dr. Forte any appointments this morning. Okay. If I click further down, I'm just going to drag. You can use the arrow on the right or drag this little bar down. I can see what his availability is for today. So I can see that he has green, which is green is good. Green means go. Okay, green means available. He is able to take appointments between 12 and 1. He has another small break here. He has appointments scheduled. I see these little heads. That means appointment. So he's seeing someone at 1 and then again at 2. Okay, then I'll scroll a little further down so you can see. He has someone slid into his schedule at 3, and then he doesn't have any more availability for the rest of the afternoon. Okay. So if I wanted to slide someone on Dr. Forte's schedule for today, maybe there's an emergency with one of his patients and they really need to get in to see him. Okay, they need to get their medication worked out. I can see that Dr. Forte is available at this time and also this time. So I'm going to schedule him. I'll give him a little bit of wiggle room in his schedule. So I'll schedule him someone at 12. And then in order to schedule it, I can right click, add. If it's an existing patient or someone in the CSB who is already enrolled to this program. So if I'm scheduling for infant and toddler, as long as they're enrolled to infant and toddler, I can use client service because they'll have all the services available. Hold is what we use for first appointments only, and we do holds from the individual schedule. So we'll get to that at a different time. Okay, for right now I'm going to do client services, and I'm going to click OK. Okay. So in this client slot, you can enter the person's name or chart number. It's who do you want to schedule. Okay, so I am going to, I believe I gave Hermione Granger an eye care plan, but it will tell me very quickly if she does not. So I'm going to use her as my test client. So I can either select tab or select find and see how it did find her in the system. Okay, and just remember, if you know their client number, you can put their number instead of their name here. Just be cautious because if you spell their name wrong, it won't find their chart. So you want to make sure whatever information is in there is right. And then over here, I'm going to go to the cost center. So it means which program do you want to schedule for? In this example, I am using the eye care program. And The service item is what is she coming in for? Okay, it is a very long list of services. Just please keep in mind it is extremely important to make sure you're picking the right service because this is what we are telling the system that that's what she's coming in for. And that's the service she's going to be scheduled to receive for that day. So whether it's an injection or a therapy appointment or an established patient visit, which is the one that I'm going to choose now, E&M office established patient. You just want to make sure you're selecting the right one. Okay. If you're ever not sure what the person is being scheduled for, you definitely want to check with the provider or your coworker just to make sure that you are scheduling them for the right thing because we wouldn't want them to get the wrong service by mistake. Okay. Then I'm going to select this button that says filter or filter list. If she did not have an eye care plan, all that stuff that just magically happened to make this window come up would not happen. I would get an error message. Okay, so that is just one thing to keep in mind, that if there are any roadblocks, it will pop up before this does, before it lets you hear. Okay, if everything is smooth and they have a plan that has that service on it, then we are smooth sailing and we are right here to this window. This is exactly what should happen. Okay. So where it says short note, that is usually either something that the doctor has told you. So I'm going to say, let's see, 90-day follow-up, just a regular, is what it would look like for a regular appointment. I can even put needs meds immediately. Crisis visit. You know, this person is in trouble. IT. Sorry, I can't talk and type at the same time. Okay, so the short note is what's going on with that appointment that the scheduler might need to know or whoever is opening that appointment up would need to know. I have seen people use it as get release signed. I have seen just like a regular checkup. One thing that I very frequently see, for example, I'm going to use my name, Stephanie Stewart. Okay. A lot of times people want to track who scheduled this. That way, if Dr. Forte says, who put this person on my schedule at the last minute, he'll know it was me. And he could follow up and I could say, yes, this person was in crisis. They needed to get it immediately. And I can give him all the details about why I did that to him and scheduled him at 12 when he thought that he had a break. So if there are any particulars with the appointment, he can see who he should check back with. Okay. The start time and end time will default based off of the service item that was selected. 15 minutes is usually the default for eye care, but depending on the service that you pick, some services have a longer default time than others. I do know that there are some doctors who like to have a little bit more time or need a little bit more time with their patients. And so in that case, I could change this duration to 30 minutes instead of 15, and then it will block off 30 minutes of Dr. Forte's schedule instead of that 15-minute block. So I'm going to change that and I'll let you know what it looks like. So I'm going to put 30 here instead of 15. There's another button here that I really like. Okay, see where it says show schedule? If I click that, it's going to show Hermione's schedule for the day as well as Dr. Forte's schedule for the day, so I can make sure there's no conflicts. I love this because if Hermione has a group, let's say she has a group therapy scheduled at 12 at our Tidewater Drive clinic, I would not want to schedule her with Dr. Forte at 12 because now she's been double booked. So just like we don't want to double book our doctors, we also don't want to double book our clients. And this way I can see that she does not have anything scheduled at 12 and neither does Dr. Forte. Okay. So I'm going to choose okay. And then see this little head that popped up, a little blue square? That means that that slot is blocked off for her. If I double click the appointment, I will see that short note. I will see the amount of time, everything we just looked at. And I'm going to click OK. Okay, so what happens if she attends the appointment or cancels the appointment, or I need to now tell the system what happened? Okay, because there's one thing to have something on your schedule, and then there's another thing to mark it as, well, they attended or they canceled, or, what happened with this appointment after it was scheduled. So this is how you mark it. Okay. One thing to keep in mind is that you don't want to mark something until it happens. So right now it's after 12 o'clock. Okay, so it's going to let me adjust the appointment however I need to. Okay, so if she comes in earlier, I can still mark it. But you want to make sure that you don't make the change to the appointment until you're aware of what it is. And I'll show you what that means. So I'm going to right click on this appointment and select status. Okay. So here I can see Hermione Granger, and on the right I can see that the status is undefined. So what does that mean? It means I haven't told the system what happened with this appointment. If I right click where it says undefined, you will get a list, a menu of choices based specifically off of the service that you've selected. So for example, some services might only have attended, canceled by provider, canceled by client. Okay, basic list. I know even infant and toddler has one called like canceled due to inclement weather. So depending on the service, we have some very specific choices. Our eye care clinic has codes, and billing is based off of these codes. So it's very important to make sure you're selecting the right one. E&M visits are typically 99213, okay, but there are some variations and different circumstances. So just make sure that you check with your department and make sure that you're marking it correctly. Now, obviously, if she canceled, I could just select cancel. Canceled with note means that I'm going to mark it as canceled, but I can indicate in the progress note area what happened. So I could say canceled due to a death in the family, canceled due to an emergency that came up. That way, if we ever review her cancellations, we'll know that it was a good reason why she canceled. And we also have some no-show options. So just be mindful to select the status that's appropriate for whatever the situation is. Okay, in this situation, I'm going to say she attended, and Dr. Forte told me to mark it as a 99213. Okay. Then it would automatically pull up, and here it is, 12 to 12:30. Now, let's say she came in at 12:05, okay, and stayed until 12:30. So instead of 30 minutes, she was seen for 25 minutes. I can mark that as well. Okay. And then delivery method, client present. Now, let me see. Yes, right now we're also using a delivery method called COVID-19 face-to-face by telehealth. Okay, so depending on whether the person was provided a service face-to-face or by other means, the delivery method drop-down gives you the options to change the selection based off of that. Same sort of situation here. If at the last minute Dr. Forte was sick and could not see this patient, and maybe Dr. Banda saw the patient instead, then I could change the service to Dr. Banda because I'm still able to edit it at this point. Okay. So I'm going to make those adjustments and click Save. There's also an option that eye care uses a lot of times. So let's say we don't have that 99213 code from Dr. Forte yet, but we do want to indicate that the person has checked in. Okay, so maybe they've come to the front desk, they said, I'm here for my appointment, and they're sitting there waiting for Dr. Forte. That's something that was very commonly happen when we were face-to-face. Okay, so you could also mark it as checked in. You could open up the service, okay, and it just leaves it as a checked-in status until I know that the service status was a 99213 or whatever. And please don't be confused about the codes that I'm speaking of. It really just indicates that certain programs and certain services have specific statuses. So if that status doesn't apply to you, then don't worry about the codes that I'm saying. I was just using an example. One thing that is also specific to eye care is this little button here at the bottom of a service called RSID report. I'm going to click on that and see if it gives me some information for her. So once you open up a service, give it a status, and then close it and open it back up again, something is generated called an RSID report. There's a lot of helpful information for individuals on this RSID report. And unfortunately, it does take a bit of time to load. Okay, so this is a report that is attached to the service and the doctor that is selected that will give information about what the doctor needs to dictate in the system if they are a person who does dictation. It also has little spots where you can check whether the individual needs an Ames test, whether they need a PHQ-9, some of the data that we follow in eye care. There's also a section for diagnosis. So whenever someone leaves the eye care clinic after they've seen the doctor gives them a diagnosis for that appointment, sometimes several diagnoses, primary, secondary, and so on. Okay, so it gives space for the doctors to do that. And when we are able to be in the office face to face with each other, this was kind of that sheet that passed around with the client. Here we go. Okay, so it allows for communication between the front desk staff, the nurse, and the doctor. So this report allows the front desk to give this sheet to the doctor so that he can put the exact time that he started. So remember I said, if they started 5 minutes late, 5 minutes early, or even 20 minutes late, or the person stormed out after 5 minutes, that's where this start time and duration would be recorded so that then the doctor could communicate to the front desk staff that this is the actual amount of time that I saw them. Now, when we're not face-to-face with each other due to COVID-19, a lot of this information takes place over email. So you just want to make sure that with or without this sheet in place, the same information is communicated back and forth between the front desk at eye care, the doctor, and the nursing staff. It also allows the doctor to write in a return appointment so that then the front desk staff knows how soon to bring her back in. Okay, so I can see below that the nurse can check any of the services that they provided, whether the doctor prescribed antipsychotic medications. That's another thing that we have to track. What the vitals are, what the diagnosis for this person is that we have, and what the insurance is. And I have not added any insurance on this particular training client, but it will tell you whether they have insurance or not, and if so, what insurance do they have. So it gives a lot of valuable information. That's why I wanted to show that report. That is typically only used for our medical appointments. So anyone who comes into our eye care clinic or even our child and adolescent eye care clinic, we use this for communication between front desk and nurses and our doctors. Okay, so I'm going to close that out. And then when I saw that RSID report, there is a drop down here, antipsychotic medication prescribed. If it was, then I could select yes or no here. So there are certain parts and pieces that are applicable based off of what's going on with your individual and what program it is. Eye care, I think, is by far the most involved when it comes to the different statuses, okay? So just make sure you pick the appropriate status based off of what happened. I'm going to click OK. When someone is checked in, it makes a little star here, okay? Let me do status of 99213 and OK. Now, whenever you choose a status, and this is beneficial if you are a biller or a scheduler, the status attaches to the service on this tab. Let me drag this window down, called Other Info. The service status is here. This drop down here allows us to select what diagnosis that we're billing under. Okay, so there are certain things that we can attach to the service directly from the appointment schedule that can make things billable or not billable or whatever the case may be, because obviously we would not bill for a canceled appointment, but we would bill for a doctor's visit. So again, please just keep in mind that the service statuses and the information are going to vary based off of the program that you're in. Okay. Now, what if I want to load the rest of Dr. Forte's week? I can click this little dot next to weeks instead of day and load. And now I can see what his schedule looks like for the whole week. Now, I really like the way that this schedule looks because I'm a visual person. However, what if you need to schedule someone out and it was a pretty far in advance? You can look for an opening, and that's what these binoculars do. So I can click on the binoculars to find an appointment. And there are two ways that I can find an appointment. I can find a scheduled appointment, or I can do find available time slot. Okay, so if I'm scheduling, I can select find available time slot. The service item is I'm going to choose E&M, established patient. See that duration pulls in for 15 minutes, so it's going to look for a time when Dr. Forte is available for at least a 15-minute window. Some services are an hour, and so a 15-minute window wouldn't be enough, right? So it knows whether Dr. Forte has availability based off of the duration. Okay. Let's say instead of today, he needs, oh, she, let me get my pronouns for my person correct. Okay, so August, September, October, let's say they're coming back in several months. So I can skip to November, say, oh, Dr. Forte wants you to come back in November. So I can look out, and I can even say, I want to look out the first 14 days in November for Dr. Forte's availability, where it says maximum number of results to display. I usually bump that up so I can give the person a couple of options. Okay, and then I'm going to choose Find Next and see how Dr. Forte's name pulls in as the provider and the location is already there. So it's just looking for an available time slot for Dr. Forte for that first week in November. Excuse me, the first two weeks in November, starting from November 13th. Okay, so I have several options for November 13th and several for November 16th. So that way I can offer my person a couple of different days and times as far as what works best for them. And so if I click on, let's say I'll click on this one for the 16th, it'll take me directly to Dr. Forte's schedule for November 16th, and I can say, hey, would you like an 11 o'clock on November 16th with Dr. Forte? It's a Monday, okay? So that really helps with scheduling, okay? So I hope that that helps you. And just please know you can also, like, let me switch providers. Can switch over to pediatric mental health nurse practitioner, Jill Jones. I can adjust the date and go back to today. I can see her availability for 1 week. I can click on the load appointments. Oh, okay, so it also depends on, I forgot to say, if your provider is not at certain locations on certain days. So for example, we have some providers who split their time. Like Dr. Sullivan may work in PACT, but she also works in eye care on certain days to help provide coverage. Jill Jones, she is a fantastic nurse practitioner. She works in child and adolescent clinic as well as the detention center, as well as the eye care clinic. So I also need to make sure that the date range I'm selecting includes days where a provider is at certain locations. And you'll get this, what provider works where on what days. The longer you work in the program, the better you will know it. But the system will even show you. Okay. So I am going to, you can either save or cancel at this point. And I didn't schedule anything for her, so I'm going to say cancel. And then that's it. I'm going to follow up with a different video about what to do when a client calls and you don't know who their doctor is, and you don't know kind of who they might see or when their appointment might be. And I'm going to show you how to look for those appointments as well. So, but I'm going to split that into a different video. I hope this was informative, and I appreciate your attention, and I hope you have a fantastic day. Thank you.